and start. So hello and welcome to Thursday Zoom. We're glad that you were able to come and spend some time with us. Before we begin our lecture, I want to talk about some things. Now, I want to preface that by saying I'm talking about some things, but that does not mean they're directly related to either one of you, okay? This recording's going out to the entire Miss Danielle's classes and my classes. I want to talk about the importance of getting your labs done. It seems as though in this module particularly, we have a great number of students, again, not saying it's you guys, a great number of students that are not doing their labs and they're asking us to reopen. And I just want to give you an example. So say that out of my 50 students, 10 of them want stuff reopened and there is 5 assignments. It's 50 assignments. I'm having to go in, reopen, given a new due date. That's a lot of work. And then half do not go in and do the reopen. It's very difficult for instructors. So we try to be very generous in allowing you to ask us to reopen things, but we're getting to the point to where we're going to have to start saying no if we don't have more follow through. We don't want to get to that point. So if you ask us to reopen assignments, please have the courtesy to get in and attempt to do them. Say that I reopened 5 for you and you were only able to do 4. That shows a level of I tried my best. And so, yeah, we can give some more time. Hi, Lexi.
Hey.
How are you doing?
I'm doing good.
Good. So any questions about asking for labs to be reopened and why it's getting to be a really big job to keep those open longer?
No, ma'am.
Okay.
Well, since we're doing our updates at the top, Marsha, I'm gonna go ahead and jump in there too about some updates. I kind of horned in on this last lecture and I want to speak on it again because I want to make sure that everybody has a very good understanding. This is a short module. We came out of a module that was extremely long. Do not wait till the last minute. Even with Ms. Marsha saying that assignments need to be done, we do not have that type of time in this module. This module is going to open and close fairly quickly. So it is really important that you're completing those daily assignments daily, that you're getting those labs done, because before you know it, as quick as time passes, it is going to be over with. This module is not as long as the last one. So I want to make sure that I emphasize that again. This is a short module.
Thank you, Miss Danielle. And so away from the housekeeping, that's what we call that. Let's do some housekeeping. I want to remind you that we're off on Thanksgiving, the Thursday that's Thanksgiving, and we're off the next day too. So we have a 4-day holiday. I would love for you guys to get as much of your schoolwork completed, get your schoolwork completed, so you can have those 4 days off and then come back on that Monday ready to go. Because we have only a few short weeks before we're off for Christmas.
Yes.
And then we'll leave, I think Christmas falls differently this year. I think Christmas falls
on a Sunday.
Yeah, on a Sunday. So we will do school up until the Friday before Christmas. But then once the next week comes, we don't return until January the 8th.
Wow.
Now, that gives you guys lots of time to think about, man, I like it when I don't have to do any school. We're going to be giving you some fun projects to do. I'm just doing one. I'm sure Miss Danielle's going to just do one thing. Sorry. For you to do over your break. So that way you don't get completely out of the swing of things, because we will be doing the Bring Them Back campaign and there's going to be some prizes given. And so it will definitely benefit you to come back, and don't make us send out the posse and come find you after Christmas break, because nobody has time for that, right?
Yeah, because we come with flashlights on our heads in the dark, so we don't want to.
Miss Danielle and Miss Marsha, open up. See, y'all have double trouble, because if she's looking for you, I'm gonna be looking for you too. So, and vice versa. All right, so any questions? So today is our first day in chapter 26. Has anybody taken a peek? No,
yet.
Really?
that's okay. That's all right. Specifically today, we're going to be talking about vaccines. Now, I want you to take a breath because it looks and seems extremely complicated, but it is really not. Chantrell's going.
Chantrell must have looked at it.
It's really not. We're going to do a little lecture. Then we're going to listen to the queen of all things, Miss Contempo Coding. And then we're going to do a few scenarios together. So it's not going to be complicated at all, but it's going to get you started. You know, you got to crawl before you walk, right? So that's what we're going to be doing. All right, so let me share my screen. Can you guys see? Chapter 26, medicine. So I'm just going to give you some facts about the medicine section. The medicine section includes codes 90281 all the way to 99607. That's a pretty big range. You guys, when you did heart caths and things like that, you hit the medicine section a little bit. And is used for coding diagnostic and therapeutic services that are generally non-invasive. Some invasive procedures, such as cardiac catheterization and percutaneous thrombectomy, are included in this section. So, you know, it spans a bit. The various subsections contain many specific notes to be used with certain groups of codes. These notes are important for coders to read so they can code services appropriately. Notes and guidelines. So what color are our guidelines? What color is the paper?
Green.
What did you say, Dawn?
Green.
Green. They're green. And remember, we don't just have those, the green section. We also have little paragraphs sometimes ahead of our subsections that it's good for us to review. Okay, so we're going to talk about some terms. So IV means intravenous, right? Is a medical technique that administers fluids, medications, and nutrients directly into a person's vein. And this may look familiar if you haven't had something like this done to you. You've seen a loved one with it. So this is intravenous medicine. Excuse me. IM, which is intramuscular. An intramuscular injection is a technique used to deliver a medication deep into the muscle. Doesn't feel good, does it? This allows the bloodstream to absorb the medication quickly. And you can kind of see, you know, the top layer of skin, the subcutaneous tissue, and then all the way down to the muscle is where they're injecting the medicine here. IA, which is intra-articular. You have to say that slow. I cannot say that fast. An intra-articular injection is a type of shot that is placed directly into a joint to relieve pain. So can you see right here? It's going into the arm joint. I can't tell if that's the pelvis or the...
It almost looks a little bit like, is it giving me a knee? No,
I don't know, but you get the point. There's a joint there and the injection is going in.
It's definitely a shoulder. I think that is. When I think about articular, again, you got to say that slow. For people that suffer with like knees, like they having like knee replacements and just the pain that comes before it's time to actually replace that knee. A lot of times when they go to the urgent care or they go to their primary care physician, they'll give them this type of shot to give them a little bit relief of the pain until they can get that surgery scheduled.
Subcutaneous. A subcutaneous injection is a method of administering medication. Subcutaneous means under the skin. So you can see, and this is insulin. So if you're a diabetic and you have to squeeze that little bit, and that is subcutaneous tissue. All right, so we're gonna have a little exercise. So let's take a look. Let's look at number 1. So it says artery, and the injection is going into the artery. So what do we think that is?
Intra-articular.
We want to go intra-articular? Okay. Let's just keep that for now. Here, it's going straight down to the muscle. So that would be I
said
am.
it.
I heard somebody say I am, but it was very, very light.
Yeah.
Yes, it's intramuscular because we're going all the way down to the muscle. Okay, number 3, subcutaneous tissue, your injection's going in. So what's that?
Subcutaneous.
Right, SUBQ, right?
Mhm.
All right, and number 4, this is the vein, and it's going into the vein. So what are we thinking? IV. So Miss Dawn, that was intra-articular because it's going to the artery. I don't know. I was just trying to give you a hard time, make you feel make your nerves feel shaky, but I don't think it worked. What do you think, Miss Danielle?
I don't think so at all. She knew she
No,
was great.
she knew she was right. Okay, we're going to do an introduction to immunizations. There are 2 types of immunizations, active and passive. Active immunization is the type given when it is anticipated that the person will be in contact with the disease. Active immunization agents can be toxoids or vaccines. Okay. When we think of toxoids, what do we think of? Toxic material, right?
Mhm.
Sorry, I needed a little drink there. Toxoids are bacteria that have been made non-toxic, and when injected, produce an immune response that builds protection against a disease.
We have a shot that recently came out that does just this, and it's something that happened recently. What is it, y'all? It is a toxoid. And I didn't know that, Miss Marshall, you taught me something today, but I knew what the injection did and I knew how it came about. So it tells me what it is. What is that injection, you guys? Something new that we recently just started getting. Some people chose not to do it. Some people chose to do it. Some jobs.
COVID.
COVID
vaccination.
toxoid, because it was made non-toxic and then injected into our immune system, and then it built the antibodies to help us to protect ourselves from that virus.
Isn't the flu shot the same?
Actually, the flu shot is a little bit different because the flu shot actually is not toxoids. It's actually the actual virus. They're giving you the virus itself. It's not the actual virus, but they make a pattern that looks like the virus so that your body can follow that pattern and then begin to fight it. So oftentimes when you take the flu shot, you begin to feel sick. You start to get the aches and the pains and all of that because they're giving you something is live, whereas this is not live.
Okay.
Vaccine are viruses that are given in small doses and cause an immune response. Passive immunization does not cause an immune response. Rather, the injected material contains a high level of antibodies against a disease. For example, rabies, hepatitis B, tetanus, and these are called immune globulins, not goblins, globulins. You will hear me say globulins 100 times, but since I'm doing it slow, we're going to do it right. The first 3 subsections in the medicine section are immune globulins, serum, or recombinant products, immunization administration for vaccine and toxoids, and vaccine and toxoids. So the one thing that you need to remember is that when you're coding vaccines, you're usually going to have two codes. You're going to have what the vaccine is and the administration of. And that's where that IV, subcutaneous, intramuscular, interarticular, that's where you're going to see those specific phrases in your CPT. Immune globulins, the immune globulins 90281 through 90399 are passive immunization agents obtained from pooled human plasma that is immune to a particular disease. The codes in this subsection identify only the immune globulin product and must be reported with the appropriate administration codes. And these are the administration codes. I'm not going to read those out loud, but we are going to see those in your CPT. So if you don't have your CPT in front of you, please get it. And if you have tabs, have them ready. Codes in the immune globulin subsection are categorized according to the type of immune globulin, rabies, hepatitis B, etc. Method of injection, IM, IV, SC, etc. Type of dose, full dose or mini dose, etc. All right, so are you guys ready to watch our Contempo coding lady? It's 10 minutes, okay? It's not a real long one. First, let's look at the commercial for stretch marks.
Hey, coding crew. Today I'm going to cover a really important topic, and that's coding for vaccine administration. I'm a medical coder, auditor, educator, national speaker, podcaster, YouTuber, content creator, and on my channel, I discuss tips, tricks, and tutorials to make you successful in a medical coding career. So if you've been coding since we were in ICD-9, you might remember that when we used to code for vaccines, you used to have different ICD codes for the type of vaccine you were giving, for if it was a flu versus a pneumo versus an MMR. And it was such a pain. And one of the great things that happened when we transitioned to ICD-10 is actually the diagnosis code changed to just Z23. So any immunization you give now is going to have Z23.
Okay, so in your ICD-10 later, you can go label Z23 goes with immunizations only, and you're going to have your diagnosis code every single time.
3 is the diagnosis, and you no longer will have to cross-match and make sure that all of the diagnoses match the appropriate vaccination given. Hallelujah, ICD-10 made one thing in our life easier. When you're coding for vaccines, you have two things you're probably going to code for: the medication and for the administration. Now, there are certain state programs where there might be vaccines that are given for free. I'm not going to talk about the specifics of those programs and how you bill for those. Check out those guidelines for the state on how they want those billed out. Right now, I want to focus on the coding for the administration of the vaccines. So when we're coding for vaccines or immunizations, one of the first things you want to think about is the route. So how is this being given to the patient? Sub-Q, IV, is it an oral vaccination? The next thing you want to think about is the patient's age, because there are some administration codes that are based off of age. So if the patient is out of that age range, you can't use that code. Next, you also want to look at potentially if counseling is performed and documented, and that is a big key. And things that people miss a lot with these vaccine administrations is there certain codes that require counseling, and you have to prove that the counseling was done, not documented, not done. If it doesn't say you did counseling, you didn't do counseling. Another consideration is if we're doing it by component, because we're using the with counseling codes, or if we're doing it per vaccine. Keep an eye on those. When they say component in CPT, what does that mean? Well, think about an MMR. How many components are in an MMR? Well, there's measles, there's mumps, and there's rubella. So there's 3 different components in an MMR. So you would use a 90460 for that first component, 90461 for the second component, 90461 again for the third component. Versus if it's a patient who wasn't counseled or is above the age of 18, that way you would just use 90471 because that's just one vaccine, but it has 3 components. And then just to mix it up, there's a couple of different codes that we use just for Medicare patients, so pay attention to their insurance. Now, let's get into our book and take a look at some of these codes. So our first set of codes here are 90460, 90461, and if you look at them, they are.
Okay, I'm going to give you time to get there and then we should be in good shape. Okay, are you ready?
Are through age 18, which means 19 and up would be not included in this code, via any route of administration, with counseling by a physician or other qualified healthcare professional, and it is for the component. So these here are our component codes. Okay, so in order to use any of these codes, it has to be a patient that is younger than 19 years of age, and we have to have documented counseling, and it is per component. Now, our next chunk of codes here are 90471, 90472 are per vaccine. So you can see here, this is per vaccine. And they are percutaneous, intradermal, subcutaneous, or intramuscular vaccines, and they are per each vaccine. So instead of components, they're by each vaccine. So even if you're giving an MMR, you would only use this code once because that's one vaccine versus the components here where we're using 3 different codes, 90460, 90461, 90461 again for each component of that MMR. After that, we have the 90473 and the 90474s. And these are for our intranasal or oral vaccines. One thing I want to pay close attention to for you guys here is that when you are coding for these, look at these ones here. It says you cannot report this 90473 in conjunction with 90471. So if you're doing an oral vaccine and it's not like one of these ones, because it says here like any route, you can only add on this 90474 because this one doesn't have that do not report. It actually says to use the 90474 in conjunction with the component codes or the per vaccine codes. So just make sure you're aware here, this 90473, you cannot use it with the 90471. And this one here is actually an add-on, not just for this code, but you can use this add-on oral vaccine code with the 90460 for the components, the 90471s with the per vaccine. Or of course, if you're giving multiple oral or intranasals, you can use it in addition to the 90473 code here. Now, of course, our beloved Medicare has their own administration codes that they use just for 3 different vaccines. First is the Medicare influenza, which uses G0008, the pneumococcal, which uses G0009.
Okay, so where would we find these codes?
Your G codes.
Maybe they weren't here when we talked about that, Miss Danielle. Some of them are newer.
Yeah, because Chantrell and Dawn are both pretty new. Lexi's not with us. So yeah, maybe not.
The HCPCS manual. It's the little bitty purple one.
Yeah, the little thin one, the only little thin one we have. All the rest of them are big, huge. If you
Monster
wanna think
book.
about it in your mind, think about your G codes little book.
Okay.
And then the hepatitis B is G0010, and that's for Medicare and some of our Medicare Advantage patients. I can't say specifically which ones because that might vary based on your area. You know what, let me just show you a quick example of some vaccine administration coding. If we have a 16-year-old patient coming to the office for a flu shot and the MMR, if we are doing counseling, and again, we have to document that that counseling was performed, you would use 90460, and you would use 90460 again, and then 90461, 90461. So the reason we use that 90460 twice is that description of that code says it is for the first component of each vaccine. So that first 90460 is for the first component of each vaccine, meaning the first influenza. And then again, first component, the next vaccine is the MMR. And then those second add-on components for the mumps and rubella, 90461, 90461. So that's another thing you have to keep in mind is that 90460 is for the first component of each vaccine. So if we're doing 5 different vaccines that day, we would use that 90460 for the first component of each of those 5 vaccines. So we would use it 5 times.
So do you have to write 90460 5 times? What's another
No.
option?
You times
But times 5.
Or they can identify them also by units.
Okay, let's keep going.
If no counseling is performed, remember we use these codes that don't have the components, they're just per vaccine. So we would use a 90471 for that first vaccine, and then 90472 for the second whole vaccine. Another thing I want to talk about with vaccines is that you actually can't bill that nurse visit, office visit, the 99211, with a vaccine administration code because there's a CCI edit. So that's not even when you can like slap a modifier on. So those level 1 established patient office visits can never be billed with vaccine administration. It's double dipping actually if you would bill for a nurse visit at the same time the patient's just coming in to have vaccines done. Another thing to think about when we're discussing per vaccine versus per component.
I'm so sorry, but the office cat just jumped on the
And that's good, Marsha, because it'll give me a minute to actually kind of elaborate for a second on that. She just told us some very good information. You know, back in a couple of modules ago, we did a lot of evaluation and management. And, you know, during that evaluation and management section, we were billing for specifically the 99210, all of the office visits. And she just specifically stated that when a patient is coming in for vaccinations only, meaning when they schedule their appointment, they schedule the appointment for a vaccination. We can never actually go in and build that evaluation and management code along with that vaccination code because she said something about CCI edits. When you get into billing, you're going to see a lot of information about CCI edits, and these edits are coming straight from Medicare, which is basically telling us as billers, we cannot bill for a office visit along with the vaccination. As she stated, it is double dipping, and if you do it, they're going to deny maybe even the whole claim, or they may deny one of the other line items. So keep that in mind. It was something else. Oh, and for those G codes, most of the time when you're billing out G codes, the only insurance that still takes G codes is going to be Medicare. You won't bill Medicare to any other payer. You won't bill those G codes to any other payer besides Medicare. So just something to keep in mind.
Hey, you've got sun, sand, and me, a giant sit on your
vaccines. So if we're doing 5 different vaccines that day, we would use that 90460 for the first component of each of those 5 vaccines.
let me
So we
get-
would use it. Another thing I want to talk about with vaccines is that you actually can't bill that nurse visit, office visit, the 99211, with a vaccine administration code because there's a CCI edit. So that's not even when you can like slap a modifier on. So those level 1 established patient office visits can never be billed with vaccine administration. It's double dipping actually if you would bill for a nurse visit at the same time the patient's just coming in to have vaccines done. Another thing to think about when we're discussing per vaccine versus per component is flu shots. Think about when providers are having flu shot clinic days in their practice where patients are coming in, they're getting their flu shot rapid fire, boom, 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 boom. In those situations, sometimes providers don't have time to do all the counseling. They don't want to worry about documenting all the counseling. So is it easier from a workflow process to just say, hey, everything is a 90471 except for those Medicare patients? So when I looked at my fee schedule, there's no difference between a 90471 and a 90460. So where that extra reimbursement comes in is where you're actually billing those additional components, where you're doing like a TDAP where there's extra components and you're billing extra. So for something like a flu shot, it might not make a difference because you're just billing that one base code and it's going to be the same reimbursement. I am not saying don't counsel the patient. I'm not saying don't document or do document if you did or did not counsel. All I'm saying is that reimbursement for the 90460 and the 90471 are probably the same. So again, those reimbursements are really only going to change when you're doing additional components. But remember, you want a code based off of what is correct, what is compliant, and not just what will be financially advantageous. So I hope that helped clarify some of your confusion about vaccine administrations. If it did, make sure you give this video a big thumbs up and don't forget to subscribe, hit the notification bell so that you don't miss any more of my helpful episodes. I will see you in the next video, and until then, please just keep on coding on.
I love her.
I know listen, I know it seems like every time we do a lecture class, I put her on here, but she teaches me something every time I listen to her. And then she feels so encouraging. All right, so are we ready to code? So, do you guys think you need to go to your index to look for these codes? Or you feel good about just doing it? Let's
I
look
think
at
the index would be best
the index.
for me. Yes.
Okay, well, you guys do it however you feel.
And Trail's mine. She know how we are with those index. With that index, we I've pounded it into y'all head with those index.
Okay, well, I'm going to give you a little tidbit. You're going to find it under vaccines and toxoids in your index, not the name of the vaccine. Okay, so a parent takes a 9-year-old child to the child's physicians for a poliomyelitis vaccine. IM. The physician's assistant evaluates the child, which is an established patient, and administers the vaccine to the child. So CPT codes, we need the polio virus vaccine and we need the administration code. So if I go to my index and look for vaccines, and toxoids, and we're looking for the polio. Okay, polio virus. And it gives us 2 choices. Intramuscular, which is 90713, and subcutaneous, which is 90713. So it's either 90713 or 90713. So now we're going to go back to our tabular and we're going to look at 90713.
I kept reading this over and over, you guys, looking for the route of how it was given, and I kept looking over IM over and over again. That IM is our telltale for what code we need to choose.
Right. So IM stands for intramuscular, which means we're going to the muscle. So 90713 says polio vaccine inactive IPV for subcutaneous or intramuscular use. So would that fit the bill for our polio virus, the 90713?
Yes.
All right, so now we have to do our administration codes, which I'm just going to go back to where I was before. So this patient was 9. So do we think that we did counseling? Does it specific? Well, it says assistant evaluates the child. I don't think that's the same thing as counseling, though.
I don't think so either. I think in assisting, I think that may have just maybe just holding him down so he doesn't flinch as that needle is going in.
Yeah. So does anybody have an answer on what the administration code would be? Remember, we were at the 90460, 90461, 90471, 90472. That's where our administration codes are. And I just put me a bright orange sticky note on it so I could go back to it easily.
90471.
So 90471 tells us it's an immunization administration, includes percutaneous, intradermal, subcutaneous, or intramuscular injections, one vaccine, single or combination vaccine toxoid. So do we agree?
Oh, okay.
All right, let's take a look. 90713 and 90471. Great job, Dawn. Perfect.
Mm-hmm.
So let's talk about this one. An established patient, 10 years old. The only service for the visit is an injection of DTP, diphtheria, tetanus, toxoid, and pertussis, and poliovirus. Services were provided by the nurse at the direction of the physician. What are our CPT codes? So we need our DTP vaccine. So Chantrell, did you find it in the index?
I'm still looking.
Okay, I'm not rushing. Do, 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 do. No pressure, no pressure. The age is very important.
Mm-hmm.
Does somebody have our DTP vaccine code yet? Sorry, 3 teenage boys just came to my window and went, I had to wave at them so they would go away. Miss Danielle, why don't you give us our DTP vaccine and why you decided that was it?
So I am looking, and I don't know if it's because I'm actually in an older CPT book. I need to get into my new one. But y'all, I'm seeing ages 4 through 6 for DTP. Then I see 7 for DTP. I see another 7 for DTP. Are y'all seeing 10? I'm not seeing 10.
Look at 90715.
That's why I'm not seeing it, because I don't have a 907. Oh, yes, I do have 5. It's the very last one at the bottom. Didn't look at that one. So DTP vaccine when administered in individuals are older. There's the word I was looking for. Or older. I did not see that or older word, y'all. Did y'all see that or older word? I was specifically just looking at numbers.
Chantrell, did you find 90715?
Yeah, I see it.
So do y'all think that that's our code for
Yes.
DTP?
Were y'all looking at the numbers too? Like I was looking at just numbers. I was not actually fully reading that code. So
Yeah.
that or older crossed right over my head. I just kept going.
Well, Danielle, I'm going to be transparent to back you up that I used the same scenario the last go around and I have it highlighted. I knew that.
I had to actually go hunting for it with y'all. So I was right there in the trenches with y'all.
Listen, sometimes when I'm a hunting, I just sit here and smile. Y'all find it. Okay. Okay, and so we also need our polio virus. Did we just do polio virus? 90713, was that our Polaroid polio virus? So we don't even have to go look for that, right?
Yeah, I just did that one.
90713. Now we need our administrations. And do we need an administration for each one of these vaccines?
Yes.
We do. All right, so let me go back to my bright orange sticker to go back to our administration codes. Remember, they start at 90460.
Yep, 460.
Okay, and again, I don't see any counseling here.
I don't either.
Who else do we have in class with us, Miss Daniel? I can't see anybody but
Lexi's here with us.
yeah, Lex, you there?
Yes, I've been putting some of them in the chat.
Oh, I can't see it when I'm on share. Okay, would you like to give us our 2 administration codes, please?
Yes, ma'am.
Oh, look, Lex had put the answer for the last one in there. I did not see it.
Yeah, I can't see. Well, I can see that there's one in there, but like it doesn't.
Yep, she had gave us an answer for the last one. Okay. So
Yep.
our first administrative code, it tells it comes with specific details. Do not report 9047 in conjunction with.
So I was looking at 90460, but that's through 18 years of age via any route with counseling. So 90460 and 90461 are out because we didn't do any counseling that we see. And if it's not noted that there was counseling, we don't code it with counseling. Not documented, it didn't happen.
I would say 90471 and 90472.
90471, which is immunization administration, includes all these different ways to go, all these routes, one vaccine.
Route of administration.
And then, but that's only one vaccine. We have two, right? So
Mhm.
she chose 90472, which is each additional vaccine, single or combination. So let's check our answers, guys.
Add-on codes.
90175. Is that what we had before, Danielle?
Yes.
Okay.
Yes.
Yeah, I'm glad y'all wrote it down because I did not. Then we had our 90713, which is our polio virus. 90471 for the first and 90472 for the second. Now, are these big, bad, and scary now? No, they're actually not.
I have a question.
Okay.
It being established a new patient, does it matter in this situation?
I want you to tell me, that's a beautiful question, Chantra. I love that question because if you remember a few minutes ago when we were going through Contempo coding, she made a very, very good point that sometimes it will reference to us if that patient is established or if it's a new patient, which is going to be our evaluation and management codes, right? Where we code for those 99213, 99214 office visits. But remember, when a patient comes in for vaccines, we cannot bill for those evaluation and management codes. So that established patient would be a E&M code. We can't bill both with the vaccine.
Okay.
So that information in there is, yeah, it's called double dipping. So that them putting that in there is kind of just to trip you up. So make a note somewhere, you guys, because this is possibly something that you may see on your NCCT where they might be putting you under, giving you vaccine codes and also giving you information that pertains to evaluation and management codes where you can go and code it as an established patient based on the age, and you can add that code to it. But if you add that code to it, it's going to be incorrect because you can't bill both services at the same time. Another question, do you think that we can bill an add-on code without a primary code?
No.
Exactly. Those add-on codes gives addition to that primary code, right? So if we build that add-on code without that primary code, of course, it is going to deny.
I have a question. If you only bill a primary code and you can bill an add-on code also and you don't, are you costing your provider money?
Yes.
We are. If we can use that add-on code legally, because there's documentation to do so, and that's the correct way of coding, we want to always do that because we want every penny the provider is due. All right, so let's do our last scenario together. A 64-year-old established patient comes in for a trivalent influenza virus vaccine. Say that 3 times fast. Of 0.5 milliliters. Okay, so because I put milliliters in here, that automatically makes me laser focus. That's going to be important somehow. That is administered intramuscularly by the nurse. The vaccine is the only service provided at that visit.
So our keyword in this scenario is what that tells us where we even need to start. What's our main term? Where we need to start?
Influenza.
Influenza. Tells us what type of vaccine that we're looking for. And then that, what is this trivalent?
I know. I didn't.
Trivalent.
Okay, but in my index, I'm seeing 3 different codes for trivalent under.
Mm-hmm.
I'm seeing CC, IIV3, RIV3, and split RIV3.
Mm-hmm.
I think that's when the 0.5, well, maybe not.
Oh yeah, it is. I'm actually not I'm not in the alphabetic index. I'm in the tabular. So say that's when it comes into play. I'm looking at the code. That 0.5 milliliter.
Mm-hmm.
It comes into play whenever you go to your tablet and start looking at those 3 different codes, because it's only one that's giving you that 0.5 milliliters.
There's 2 of them.
I see 0.25, 0.05. I mean 0.5.
Keep going.
Let's talk 5.
There's actually 3. 0.5. I don't
Oh,
know
yep.
why it's giving
There's
us.
another one. 0.5900661. 90674. So we know that 0.5 is going to be between those 3. Let's break them down by route of administration. So 90656 is intramuscular. 90661, what is that one?
Intramuscular. And 90658 is 0.5 milliliters, and it's also intramuscular.
Intramuscular. Okay, let's move a little bit further then.
I just figured out what trivalent means. It means 3. Because there's the only reason I know is because there's a quadrivalent. Quadrivalent.
Quadrivalent. Oh, trivigilant, quadrivalent. Makes sense. Tongue ties your tongue though. So trivalent preservation.
I think I have one that I'm liking. Which one are y'all liking for it?
Influenza virus vaccine. Split virus. So split virus, I don't know. Influenza vaccine, derived from cell cultures, preservation, antibody free, 0. Okay, so I kind of like that one.
And I did not put the right answers. I just copied the answers from the last question. So this is on us.
Is it
I see kind of one that I think it is. Because then it goes into our quads. And
I'm liking 90661.
me too. Yeah, 90661.
Influenza virus vaccination, trivalent, derived from cell cultures. It just gives us way too much information that it doesn't give us here. But then you have for intramuscular use. So you have the right dosage for IM use, and it is the influenza virus vaccine trivalent. So that's what I think it is. What do you guys think?
I would have thought it was 5-6.
Yeah, me too.
Okay, let's look. Well, it says split virus.
Split virus. That's
Split
the
virus,
only,
okay.
yeah, that's the
Okay.
only word that I didn't like in that one. I didn't like that split virus. Because when I think about split virus, it kind of like says that like they're giving you a dose of 2 different type of, I don't know, vaccines maybe that is, I didn't like that split virus name word. It seems, let's see. I like to see. Let me see. Let's see what split virus is.
So now that we've discussed that, we like 90611.
Yes.
All right, so now we have to choose our administration code.
See, yep. So a split virus, there are 3 types of inactivated vaccines: the whole virus vaccine, split virus vaccine, and subunit vaccines. And split virus vaccines, the virus has been disrupted by a detergent.
Okay.
Okay, so 90661. Yeah, 90661 is our CPT code for vaccination. Now we have to decide on an administration code.
Kristen, I haven't heard from you. I see you peeking over there in the corner. What's our administration code for this last one? It's like, dang, Miss Danielle, I thought I was gonna get away with it. Kristen, are you there?
I'm here.
Okay,
I'm looking still.
okay, perfect.
Remember, administration codes start at 90460 and just kind of read down until you find one you like. I'm sorry, Kristen, I couldn't see that you were here. She almost got out a get out of jail free card, Miss Danielle. You found her.
She almost did.
Is it 90471?
I think so. What do you guys think?
I think so.
I think so too. Chantrell, you're in agreement, Lexi?
I
Yes,
think so.
ma'am.
So we coded vaccines, guys. Are you scared now?
Yes.
It's not bad, Chantrell. It's not that
Walk on
bad.
your toes.
It's not
This
that
pathology, it had my head scratching.
bad.
Well, I hope you feel more comfortable now. Remember, just take it one component at a time, one step at a time. And in these examples, they do us a favor. They tell us vaccine, 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 administration code, so it kind of gives us an inclination of how many we're looking for. But most of these vaccinations, guys, we don't even use. I mean, there's tons of them in there, but we use just certain ones all the time. So-
Repetition. It was a good example with that though, with that split in there, because it teaches us that when we don't actually understand and know some of the verbiage that is being used in the description of some of our codes, that it's good to go and look up that information so we'll have a clear understanding of what exactly that code is saying. So good job, you guys. Good job.
Any questions or concerns? No, let's
I
say
have a question, but it's not about what we went over today.
that's okay. Ask
In
away.
module 154, I turned some of my stuff in kind of late. So when I go back to look at what my final grade was, it's not up.
It's closed.
Yeah, it's closed. I can't see what I got. I mean, I know
Yeah.
it's an A. I'd just like to know my percentage.
So you're going to be getting progress reports here shortly.
Okay.
Yeah, you're going to be getting progress reports here shortly. So it'll give you an overall average of all of your grades, and let you kind of know where you are.
Okay.
But
I'm
I
just
will
gonna-
actually
yeah.
text you what your actual grade was.
I was just going to say, Ms. Marcia, that's you.
All right. Thank
I'm
you.
sorry.
You know what I realized recently? If I'd have started when I was supposed to start, I'd have been in this Washington's class.
I got her. She's mine. Ha ha ha.
Well, actually, she's both of us because we share
Well,
you guys equally. So, y'all are for both of us. Chantrell, while I got you real quick, and also Kristen, that drug panel assignment, how hard was that assignment? Did y'all find it difficult?
I mean, now looking, going over this PowerPoint, this lecture, I get it now.
Okay.
That you just put the code in and then add in the components in which you're testing for. Because when I put it in the assignment, I actually put the code for each different panel I was testing for.
Yeah. Well, yeah, in that instance, because it's drug panels, it does work like that. This is a little bit different for vaccines, but you did it right. If that's the way you did it right. Yeah. Drug panels doesn't have components per se. It's just that actual procedure was therapeutic or definitive. either one of those. Yeah.
Okay, since Dawn's percentage was so amazing, I'm gonna tell her now. It was a 96.17% A.
Yay, Dawn.
Thank you.
So, all right, guys. Well, thank you so much for coming to class. I know I took a little bit of a break, but I'm back now. I'm back now until the week of Thanksgiving, and then I'll be on vacation again. But that's okay because we're not going to be doing lecture on Thursday anyway, because we're going to be out of school
Eating some turkey.
eating some turkey. All right, you guys have a wonderful afternoon, a wonderful weekend, and we will see you next week. Let us know if you need anything.
Bye, y'all.
Bye.